Here's 1, 2, 3, 4, and 5, and here is actually 6. So I see 6 potential anatomical structures for us to consider or be observant of during needling, because we do not want to perforate through or into the wrong tissue. This is the basilic vein away from the brachial complex. So usually it's very and quite separated from the brachial artery. So here we have the brachial artery, and you'll see that it is not as easily compressible. Remember when I said we have to put the ultrasound in motion, the tissue in motion, in movement, to be able to identify it properly. When we compress, you'll notice that, and when I say compress, when I press down the probe on the arm or the tissue, you're going to notice that this particular structure is not going to compress as easily. I use these words carefully because you can still compress the artery. Try pressing as hard as you can. You're going to see that artery collapse. However, they're not as easily compressible as the veins. And so you'll find that the veins will collapse much quicker than the arteries. However, this is not always the case. This is why I do not want my orientees or people that I'm training to apply the tourniquet or use the tourniquet during insertions or assessments. Only in extenuating circumstances where you are in a rush and the speed is more important to you and the patient, then I recommend using the tourniquet. However, otherwise, you should be inserting without the tourniquet. And there's a lot of reasons. I'm not going to get into why. You're going to notice that these two structures are going to compress more easily during the compression phase of the assessment, and this is going to compress a lot less. And this here is the nerve bundle, and it's going to compress almost nil. Do they compress? Yes, but they are the least compressible structure. From my experience, the majority of nerve bundles will compress the least, meaning the arteries and the veins will compress before you can even compress a nerve bundle, and it'll be very uncomfortable for the patient. However, that will help you to identify that it is a nerve bundle. If this object compresses easily, assume that it is not a nerve bundle and some other type of tissue. You can see that it's kind of spotty. It almost looks porous, or someone said chocolate chip cookie or honeycomb. And you'll see as we move this structure, the inside is going to be quite porous, and those are usually the nerve bundles. Now, the nerve bundle has a very, very tough outer layer and tissue surrounding it. It is hard to puncture, although you can. They will generally move out of the way. However, if you are persistent in chasing after it or ignore it with a straight down vector through the center, you will poke through the brachial nerve complex. Now, what are the symptoms to correlate with nerve dissection or nerve puncture? They're going to feel shooting sharp pain to their fingers. Patients, listen up. Also, so you can keep us accountable, if you feel shooting sharp pain, not numbness or tingling. Numbness or tingling is most likely your arm just falling asleep from the awkward position. However, shooting sharp pain, electrical pain to your fingertips is not normal. Clinicians, listen to your patients when they say they have this particular pain. You're poking their arm, not their fingers. So they should not be feeling sharp shooting electrical pain, nerve pain in their fingers. If they do, you must pull back immediately. It does not mean you have to restart the insertion. It just means that you have to pull away from that structure that looks like this. And the nerve bundle will generally lie around, on top, or next to the brachial artery. Remember, our tissues need supply, and what is the most important tissue here? It's your nerve endings. So your arteries, the blood from your artery, is going to supply the oxygen much more efficiently if that nerve bundle is next to you. Now, is that always the case? Of course not. However, generally, most cases, that nerve bundle will be close to, if not next to, the brachial artery. So I want you to watch as we compress the tissue. Look at the veins. Look how easily they compress. Look at the pulsatile action. It is more pulsatile than the veins. Why do I say that? Again, veins can still pulsate. They actually do. However, they don't pulsate as prominently because the pressure is so much lower than the arteries. You'll notice with very rare cases where all structures will pulsate. And a lot of times this is due to some kind of cardiac output insufficiency or reflux or post-exertion. I have a few videos on that you can check out. However, know that I'm using the word least and not only, or least or most. So to recap, the nerve bundles are the least compressible, the arteries are the second least compressible, and the veins are the most compressible. And the arteries generally pulsate more often than not. You'll be able to observe pulsation more easily than the veins. And the nerve bundles will shift around, however, they generally are hard to compress, the hardest to compress.
Right above on the left half of that vein.